Welcome to HTB, or How to Become, the podcast where careers start with a conversation. Each episode, we sit down with someone actually doing the job you're curious about, from trades to tech, healthcare to hands-on skilled work. You'll hear how they got started, what the day-to-day really looks like, what they earn, and what they wish they'd known before they began. Whether you're a student, a parent, or someone thinking about a career change, these real stories are here to help you figure out your next step. Let's jump into today's conversation and learn how to become, well, anything. Welcome to How to Become. Today we're sitting with Joe Peters, and we're going to learn how to become an anesthesiologist. Hey, Joe.
Good morning. Thanks for having me.
Yeah, well, welcome to the show. So today we're shining a light on an essential but often behind-the-scenes medical specialty, anesthesiology. Anesthesiologists are among the highest paid physicians in the U.S., earning an average salary between $400,000 and $450,000 per year. The path to this critical role is long and rigorous, typically taking 12 to 15 years, from college through medical school and a 4-year residency. The field is becoming more diverse, with women now making up about 46% of anesthesiologists, and the average age of practitioners is around 48. To become an anesthesiologist in the U.S., the total cost of education, including undergrad and medical school, usually ranges from about $371,000 to $477,000. This does not account for residency, where anesthesiologists earn a reduced salary, not tuition, but living expenses and debt repayments continue. Demands remain high, driven by advances in surgery and pain management. Whether in the operating room, critical care, or plain clinics, anesthesiologists are masters of patient safety and comfort. Today, we'll uncover what it takes to get there and what the job's really like, and why anesthesiology attracts some of the brightest minds in medicine. So, Joe, thanks for joining us.
Thank you. Thanks for having me.
Yeah. So tell me about why did you become an anesthesiologist?
Well, I don't know. I knew I wanted to become a doctor at a fairly young age. Um, nobody in my family really was a doctor or in medicine at all. So when I was in high school, I started just working at a local hospital, like in the ER, just as a what we called a porter back then. You had to help patients, move patients from one ward to another, you know. And but I was allowed to kind of watch in the ER sometimes to see how things happen. So that was sort of my first introduction to medicine, and I knew at an early age that's what I wanted to do.
Yeah.
The path to anesthesiology is then very different because it's not really a specialty you think of. Early in your life, or even in medicine, it's sort of this, it's just kind of an odd specialty that's not really taught even in undergraduate studies. So I went through medicine and went through medical school. And my initial attraction was to work in an emergency room. I wanted to be an emergency room doctor.
Yeah. Like a surgeon?
Not just an ER. Part of me always wanted to kind of be where there was action, you know?
Yeah.
And I didn't really want an office job, really. I didn't enjoy as much sitting in an office and seeing clinic patients, you know?
Yeah.
So even though that had its own reward, I was more attracted to a specialty where I was sort of busy doing stuff all the time. So I did. So initially, I was attracted to emergency medicine and actually did a initial residency in ER medicine. And I did that for maybe 2 years, and then during my internship, I did do a rotation through anesthesiology.
Yeah.
And I always thought that was pretty interesting for the same reason that you're it's a very hands-on specialty.
Yeah.
You also don't really do clinic. You basically are busy taking care of patients all the time. Anyway, so long story short, after about doing emergency medicine for 2 years, I felt that I needed a change. I didn't think that was really the career path for me, for various reasons. But long story short, I then applied to an anesthesia residency program.
Yeah.
Got accepted, and yeah, that's how I ended up doing that.
So in a nutshell, what is an anesthesiologist? What do they do?
Well, an anesthesiologist, you really take care of the patient while they're having surgery. So your job is to really make sure that they don't. The key thing is to make sure that patients are comfortable, they don't have pain during surgery. Surgery puts a lot of stress on the body.
Yeah.
And the stress on the body is not good.
Right.
So you really want to blunt that response. So you want to make sure that the body can get through a procedure with as less stress on the system as possible. So that's the key. It really, people think of anesthesia as that you just put people off to sleep, but it's more complicated than that. Because yes, the anesthetic drugs make people unconscious, and the science is pretty complex behind it, the physiology, and no one really exactly even knows really how it works on the brain. There's a lot of theories, and the pathways are fairly well defined, but it's still a little bit of a mystery.
Yeah, they say if amongst doctors and psychiatrists and psychologists and scientists, the people that probably understand consciousness the best are anesthesiologists, because that's what you guys play with.
That's true. I think physical consciousness. I think the subconscious, we have no control over that, right? That's the field of psychologists and psychiatrists, things like that. But so people think that with anesthesia you just put someone off to sleep, but that's just one part of the anesthetic, because we basically make someone unconscious. But the body can still respond to pain. So, and if the body responds to pain like a surgical stimulus, fixing a fracture or making incisions anywhere, your body will still react to that as if it's completely awake. So how
does that manifest? Like elevated heart rate?
Correct. So typically, just like it would be when you're awake, your heart rate would go up, your blood pressure will go up.
Okay.
The body will go through a stress response. Your muscles will tighten.
Wow.
So all of those things are not good for the body.
Yeah.
If the blood pressure goes up, for instance, during a surgical stimulus, the surgeon won't be able to do their surgery, because the higher the blood pressure goes, the more bleeding they have in the field, for instance.
Yeah.
Muscles will spasm up, so it's very hard for them to get through muscle tissue if they make an incision, or if it's an orthopedic surgeon trying to fix a fracture.
Yeah.
It's very hard for them to do that because everything tightens up and spasms up. So apart from keeping the patient unconscious, you have to blunt the pain response so that patients don't feel pain, or at least limit that as much as possible. And you always also have to make sure that the patient is relaxed.
Yeah.
Because if the muscles will just respond the same way as if you're awake in a certain way. So if you don't treat that part of the system, then surgery becomes almost impossible.
Yep.
So we always think of anesthesia as having three components to it, which is one is the unconscious part, making sure patients don't remember it or are asleep during the procedure. And the second part is treating pain, and then the third part is making sure that the body is relaxed during the procedure.
Yeah.
So those three things are always part of what we're doing.
I know these are all administered or managed by the administration of drugs, of chemicals.
Correct.
Okay.
That's all pharmaceutically induced.
Okay. And so do you have different chemicals for each of those three components, or
Yep.
is it generally just one per, or
No, we use
what?
different drugs
Yeah.
to treat all those different components.
Okay.
So we'll typically use, people think of anesthetic as the anesthetic gas, for instance.
Yeah.
Those are inhalation agents. We call them inhalation agents. They've been around for
For centuries.
decades.
Yeah.
Various kinds of them. Started off with ether back in the day.
Yeah.
Um, but nitrous oxide falls in that category.
Yep.
Now with more sophisticated inhalation agents, that's one of the components of making someone unconscious,
Yep.
or to keep them asleep. We also have intravenous medications that we use frequently now that also keep people unconscious.
Yeah.
So whether you're using an intravenous drug or a vapor or a gas, those drugs mainly make patients unconscious and relaxed.
Yeah.
Then we'll typically use a drug to cause muscle relaxation.
Mm-hmm.
And then we have all the pain drugs that we use to treat pain during the procedure.
Yeah. Okay.
So those are kind of different tools. Then we use, then it's very important to make sure the patient's heart rate, blood pressure, or the vital signs that the patient goes through. We want to make sure those are close to normal, physiologically normal as possible.
Yeah.
So we'll use different drugs to treat the blood pressure or to treat the heart rate.
Yeah. So it's a whole cocktail.
So there are various things that we use.
And I'd imagine throughout surgery, it's not just a one and done. You have to monitor and administer and change.
Correct. It's very much, well, first off, every person's body is slightly different.
Yeah.
So there's, most of these drugs get broken down by enzymes that are either in the liver or in the kidney.
Yep.
Some of them get broken down by enzymes that are actually in the blood itself.
Yeah.
Blood cell itself. So, but most patients, because everybody is a little bit different, you often have to adjust what you're doing for every patient. We typically, for the most part, we start off with sort of weight-based regimen. So we'll take someone's weight,
body weight,
and then usually pharmaceutically adjust based on body weight. But then from there, you have to adjust up or down, depending how a patient is reacting to it, depending on what other medical conditions they have, and depending on, obviously the duration of the operation. So most people will react slightly different to what you're doing. So you have to kind of adjust on the fly.
Yeah. God, that's amazing. So when you're in the OR, it's constant. I mean, you have to be present the whole time.
We're present with the patient all the time.
Yeah.
You have to, because you also have to continuously be aware of what the surgeon is doing on the other end.
Yeah.
Because they might do something that's going to stimulate the patient more than they did maybe a split second before.
Yeah.
So the patient's body might react in a certain way. So you have to be ready to adjust based on that.
Okay. So let's take a step back for a bit. So for the audience, Joe's my oldest brother, but he's 14 years older than me. So, I don't have much memory of him, as I don't have any memory of him when he was younger. And I really just kind of knew you. Like I said the other day, my first memory of you was your high school graduation party.
Mm-hmm.
You were off to college and, undergrad and grad school and all that afterwards. My only memories of you really when I was a kid was you studying, in that in that living room in South Africa where the piano was, just marching back and forth, reciting things. But if we take a step back, what made you want to become a doctor? What made you want to go into the medical field?
Oh, I don't know.
Obviously you're the oldest, so
I mean, I think I didn't really know what I wanted to do really, and I think it was, back then, I think you always, when you thought of the good careers when I was younger, this is back in the 80s, you always thought of the more traditional pathways,
like lawyer, accountant,
a doctor, or an engineer, and so I never thought of myself as an engineer. I was not really that inclined. I didn't love math that much either. It's not really. I just didn't you know, I wasn't really a numbers guy either. I couldn't see myself really doing finance. And so, I kind of, after getting exposed to some of it, as I mentioned, working in a hospital a
Yeah.
little bit, I think I've more and more thought that that's something I could do.
I remember Dad told me that he suggested you go work in a hospital first before you decide to pursue his career.
Yeah, you did.
Be exposed to it, see if you throw up or faint at the sight of blood,
Yeah.
things like that.
Yeah.
Is that I mean that's I feel like there's a lot of wisdom and foresight in that. Is that something you'd recommend for other people before they decide to go in a
Yeah,
medical
I mean, I
career?
think it's becoming harder and harder to do nowadays because we have a lot more rules and regulations in the health system. So
Yeah.
for younger children to get exposed to that is becoming a little bit more challenging.
Yeah.
But kids now have, I think if you like biology in high school,
Mhm.
a lot of biology classes, they do will often dissect an animal or
Yep.
something. Um, uh, uh, my son, for instance, is taking, I don't think he's interested in medicine, but he's taking sports medicine, for instance,
Oh
this
yeah.
year. And they're learning about the knee and the knee joint and how the
Right.
ligaments work. So those are all opportunities in school where you can kind of get exposed to um, biology, physiology, that kind of stuff, and
Yeah.
if that's something that's interesting. I will say um, that it's a long and a hard path,
Yeah.
and I think you have to kind of I think there has to be a bit of a calling and
For sure.
hey, it's not so much about the money or whatnot. I feel like this is something I want to do for myself.
Yeah.
Um, and then I think it becomes a different path.
Yeah.
Then it's whether it's 10 years or 12 years, you don't really think about it as much. It's more, I uh, because it will be a journey and not a destination. And
Yeah.
so if you don't enjoy the journey to get there, I think you're gonna really be hard, be
So
miserable.
what is it about your job that you love?
Well, um, I mean, I enjoy a lot of medicine now. It's always been, but a lot of what I do is sort of a teamwork job.
Yeah.
I will often work with the same team on a daily basis, the same nursing crew, same technicians, frequently the same surgeons. I love the fact that as a team, you're able to take care of a patient through a difficult time
Yeah.
and during a time where they are probably at their most stressed or most anxious, and you can get them through a period, and they can be wake up on the other end
Yeah.
just being very thankful
Right.
that everything went well.
Yeah.
So that's the most rewarding part for me.
I bet. So if to somebody listening to the podcast now, they're in middle school or high school or maybe even their early 20s looking for a career change. I think let's focus more on like, high school students here. What are the steps to become an anesthesiologist?
Well, I think first you have to decide whether you're interested in healthcare or not.
Yeah. Yeah.
Um, I think anesthesia should not be on your top of mind. I think first of
Right.
all, do I want to, as a doctor, something I want to be? Because even in
Yeah.
healthcare now, there are various different fields.
Right.
Even anesthesiology now, uh, there's a whole specialty in anesthesiology that nurses do. They're called CRNAs.
Yeah.
We now have anesthesia assistants. So you don't have to become a doctor to become an
Interesting.
anesthesiologist. You
Yeah.
can
Okay.
do it, you can become a nurse
Nurse
and do it, a
anesthetist.
nurse
Yeah.
anesthetist.
Yeah.
You
We
can
have one
also
at the gym
become,
here.
they're not as much as California, but a large part of the country has what we call anesthesia assistants, AAs. They do a lot of hands-on clinical work,
Yeah.
and they work with the anesthesiologist in tandem. So if anesthesiology per se is your dream, there are different ways to get there.
Yeah.
I think if you want to, if and those are often shorter and easier to get to, and also just as rewarding, in the
Yeah.
same way. I think if you're thinking a medicine, MD pathway, that's that has to start after high school. You basically, well, it starts in high school because you want to obviously make sure that you have the temperament and the self-discipline to be able to kind of study,
Yeah.
a lot,
Yeah.
because it will require that.
Yeah.
Um, then, so college will be your first stepping stone. You have to go to a 4-year college. You have to get a degree, 4-year degree.
But that degree has to be, it can't be in anything, right? Does it?
It doesn't specifically have to be in
Pre-med.
in medical fields. A lot of people
Yeah.
can do it. You can major in other specialties,
Oh,
but you
interesting.
have to meet certain requirements.
Okay.
So you still have to. I think you still will have to do some basic math, physics, chemistry,
And science class, like
science
biology.
classes,
Yeah.
biology.
Okay.
But that doesn't have to be a major, so you can do that.
Interesting. Okay.
Then you obviously have to do your MCAT.
Yep.
So that's your entrance exam.
Yeah. For grad school. Yeah.
To
So
get
it's
into
like
grad school.
LSATs
Correct.
for law school or
Correct.
TMAT for business
Correct.
school. Okay.
So, and
is it
then
just one exam, the MCAT?
It's one exam.
Yeah.
But that is required. Yeah, they will look at that, your score and your MCAT too, when you apply for medical school.
Yeah.
There are a few schools in the country that offer a 6-year program, where you get into it's like a college. It's like an undergrad and med school program combined.
Yeah.
There are a few of them, and I think those are slightly more competitive, and it's you get accepted straight out of high school.
Yeah.
And then you still have to do MCAT while you're doing it, but I think they require a certain GPA, during your first couple of years to make sure that you can maintain the grades required to complete your degree.
That makes sense. Yeah. Okay.
And then once you get accepted into medical school, even different pathways for that.
But when do you apply for medical school? Is it your junior year or senior year in college?
I think I can't remember.
Yeah.
I'm not exactly
you had a
sure what
different
it's
path
like.
a little bit too.
I'm not sure what it's like these days.
Yeah.
Once you're I was going to say that even for medical school there are pathways now, because you can now do a DO degree, for instance.
Oh, what degree?
MD, DO.
DO.
Yeah, Doctor of Orthopedic Medicine. It's an osteopathic medicine degree. So you become a doctor of osteopathic medicine.
Wow.
Called DOs. Those are DO schools are all over the country now too. Yep. And you can practice medicine as a DO as well. So so you can go the MD route, or you can go the DO route.
Yep. Okay. And so med school typically is 4 years?
Correct.
And while you're in med school, are you do you start specializing then already? It's not until you do your rounds as resident.
Correct. Residency. Yeah.
Okay. Is residency your 4th year, or is it like you after you graduate from med school, then you do residency?
Start doing residency, yeah.
Okay.
And for anesthesia, it's 4 years residency.
Okay, so 4 years of undergrad.
Well, you have to do an intern year.
Yep.
You do intern year, and then you do 3 years after that.
Okay.
So 4 years. So 4 years.
Okay, so now we're looking at 12 years of schooling.
Correct.
Okay. Tell me about the process for residency selection, because
I will add that these days most medical schools will not take you straight out after undergrad.
Really?
Yeah. So you'll typically have to do your MCAT, and then you'll typically have to do some research or something else.
No way.
You have to frequently now do a little bit of research for a year, or work in the medical field, and to kind of build up your credentials a little bit.
Who sponsors that research? Is it like a government grant, so you find a professor to work with?
Typically, you'll have to find it through the medical school, or through the university programs.
Oh, wow. And
you kind of have to find that.
Is it kind of like a PhD where you have a thesis? And
no, you just often have to just find a lab where you can work at a little bit, or just show some extra experience.
Wow. Do you get paid throughout that period? It can't be much.
Not really, no.
Yeah.
No.
Wow. And is that typically through the university where you did your
I'm not sure exactly how, but there are pathways to find that.
Wow, that's interesting.
Some students will work as a maybe a medical assistant for 6 months or a year,
Yep.
or as a scribe or something where uh, it just shows where you have. It just helps to show if you had a little more experience in the healthcare field
Yeah.
for a short period of time. Typically, medical schools will want to see that these
Right.
days.
Kind of
So.
way of weeding out people who are less
Yeah,
serious
I'm
or
not so
committed.
sure, but
Yeah.
I think, yeah,
Just another
maybe.
hurdle. Wow.
But just something to be ready for. So I'm
Yeah.
saying, yeah,
Okay. So between undergrad and grad school, that's something to expect. And then your residency, now you're spending uh part of your time hands-on in the hospital and part of your time in the classroom? Or
correct.
okay. And what's that split like? Or does it
Well,
go more towards hands-on the higher up you go? Or
yeah, it's very clinical
yeah.
oriented.
Okay.
Residency is typically very clinically orientated,
Yep.
and so um, you spend most of your time in the hospital and with patients.
Okay.
Yeah,
How nervous were you when you when you anesthetized your first patient?
yeah, I can't remember, but I'm sure I
You
was.
just blacked it
Yeah,
out?
I'm sure I was.
I mean, it seems like it can be a very stressful job at times, right? I mean, things can go wrong very quickly, I imagine.
Yeah.
How do you manage that stress load? How do you manage that
Well,
heat of the moment?
uh, like most things, if you're competent in it, in other words, you have the experience and the skills, and you've learned how to deal with certain situations. That's part of the specialty. Then
Yeah.
I imagine it's like a pilot flying a plane.
Yeah.
They just know what to deal with certain scenarios, and it's for the layman like you and me, would be thinking, "Oh, that's crazy. There's no way these guys got to be so."
Yeah.
But it's like anything where with the proper training, I think you just learn to manage that.
Yeah, and you're
Um,
just kind of going through the mental checklist. Okay, if this
correct.
happens, I just got
Yep.
to do this next.
Becomes
Okay.
just becomes second nature.
Yeah.
Yeah.
Yeah. Oh, that's amazing. So, um, I guess it's not that you necessarily have to be good about working under pressure. It's just you have to become competent enough that the pressure just doesn't really feel like it's a big deal.
No,
So
because then it's just the pressure. It's not really pressure.
it's
Uh,
just another
it's
scenario you have to
correct.
deal
It's
with.
just it's
Yeah,
just something that you've
that's cool.
dealt with 100 times before.
Yeah.
So.
So what does a typical day look like for you?
Uh, well, typically my day starts pretty early. We usually start surgery at 7 o'clock in the morning.
Yeah.
So I usually get to work between 6 or 6:30,
Hmm.
and then you will typically make sure that everything is set up in the operating room, ready to go. Your medications are ready. Typically, you'll see your patient, interview them, do a physical exam, make sure they're ready for the anesthetic and the procedure.
Yep.
Um, Sometimes, in what I do, we frequently will do uh, what we call a nerve block. So
Yep.
we'll do an injection somewhere, especially for orthopedic surgery. For instance, if they're working on the knee or on the arm, you can do an injection to numb up the nerves in that arm
Yeah.
or in the leg or whatever part of the body they'll be working on, um, which will help with managing pain during the operation.
Yeah.
And we'll often do that before we get started, in the operating room. So sometimes there are procedures that we do before we go back to the operating room, and then when the day starts, and we'll depending on how busy that is that day, you'll typically have a full days of work, and
Yeah. How many surgeries typically in a day
well, it
for you?
varies. Depends
Yeah.
on what you're doing. Some operations take longer than others, so you could do some days we'll do a lot of small operations, and some days we'll just do maybe one or two bigger ones.
Yeah.
So depending on what you're doing for the day.
And now is it you only get paid per surgery, right? I mean that's or is it more of like a salary based job?
Um, well, it depends. These days in medicine, there are salaried positions.
Yep.
Like if you a lot of health systems, universities, you typically are salaried.
Yeah.
Um, uh, some of the private practice jobs or in medicine in general are what we call RVU based. Basically, it's unit based work.
Yeah.
So
Yeah.
depending on how many patients you see for the day, the more
Right.
you get paid based on that unit.
Yeah.
Um, uh, and there are variations of that throughout the medical practice, so
Yeah.
depends on the setting that you're working at, how you get paid for the day.
Right. So, if you take a week off, you're not earning money for that week,
Well,
basically.
again, if that's if you're an RVU, if you're
Yeah.
RVU
Right.
based, in other words, if
Right.
you're productivity based, then yes.
Yeah.
If you're working as a salaried physician, then you typically will get your time off and you get paid for it's a
Right.
salary. This doesn't really.
And then, how does it work with these hospital groups that you work with? Do they provide 401ks for retirement or?
Typically, yep, yep.
Yeah.
So if you're an employee, the employer, whether it's a big university health system or any sort of system that you're working for, whether it's Kaiser Permanente or one of those, for instance,
Yeah.
they will offer typically a pension or a 401k
Yep.
and benefits, that are sort of part of the package.
Okay.
So if you're more private practice orientated, where you're kind of working for yourself,
Yep.
then obviously it's a different setup. Then you have to fund your own retirement,
Yeah.
which is what I do, or you have to fund your own benefits and things like that.
Yeah. And
So it
then there's
depends on.
also the option to work for like a anesthesiology group, and then they contract out to the different hospitals, right?
Correct. And
Yeah.
those are more sort of private practice type groups.
Yeah, gotcha.
Yes.
Okay.
Yeah.
And then that organization that you're working for then handles your all the administrative.
Yeah, and even those vary in size, and some of them
Yeah.
are employee based. In other
Yep.
words, you get a regular employee salary, and some of them are more. And then
RVU.
there's others that are more RVU based.
Yeah.
So
Yeah.
you just use the group structure for to basically do your contracting, and handle your schedule and stuff like
Right.
that.
Right.
So
So you've mentioned a little bit about some of these qualities that you'd need, the ability to be able to focus and have the discipline to study. What uh what qualities do you think make up a good anesthesiologist?
well, you have to have good people skills
Yeah, it seems
for
like
sure.
bedside manner is definitely a big
Yeah,
part of
you
it.
have to
Yeah.
be able to uh,
Because you're
be
the last and
comfortable
first person they probably speak to, huh?
often.
Yeah.
So you have to be comfortable uh, dealing with people,
Yeah.
and then you have to there's a fair amount of hands-on stuff that you're doing. So being good with your hands is also a good
Yeah.
skill set to have, and that's not sure really how to define that, but I
Right.
mean you have to have some pretty good hand-eye coordination
Yeah, and
and
dexterity.
dexterity to
Yeah,
kind of think through things without, because you can't really freeze in the moment,
for sure.
So there are uh, so I would say those are good added skills to have, and obviously all those things are things you can learn,
Right.
um, but that helps to have that in addition to, obviously, you have to have the knowledge of what you're doing and be able to think things through.
Yeah. Now I remember you studied a lot of chemistry when you were going through
Yeah.
your specialization. I think you were doing that while I was in chemistry class in high school. We'd share notes sometimes. So yeah, I think that takes a certain mental aptitude as well, right?
Yeah, well, the chemistry is because a lot of anesthesiology is pharmacology based.
Yeah.
Pharmacology is obviously a lot of that is chemistry. So,
Yeah.
yeah.
What advances do you see happening in the field? Is it really just pharmacology, just different types of drug
Well, I
mixtures and
mean, yeah, I
cocktails?
mean, well, uh, there's always newer and better drugs that come on the market that we can use that are
Yeah.
maybe faster acting or have fewer side effects.
Hmm.
Um, uh, uh, because it's kind of still a skill set that requires a lot of hands-on doing.
Yeah.
Um, I don't really see that being replaced necessarily
By
by
robot.
robotics
Yeah.
necessarily, although who knows where that technology goes. AI might come into play with how it analyzes patient vital signs and things like that,
Right.
and
Right.
maybe there might be some additional tools that come in and make that the the prompting or the thinking a little bit easier
Yeah,
as
more
when
more
you do
precise
anesthetic.
probably. Yeah.
Um, so, uh, but all these disruptions are on healthcare all over the place. So,
Yeah.
I'm sure we'll see technology in that field also improve,
Yeah.
generally how we do things.
Are there, you mentioned earlier, like different types of ways to get into anesthesiology, such as nursing, and that, but uh, as far as the anesthesiologists go, are there different specialties as an
Yeah, well,
anesthesiologist?
after your residency, you can do a fellowship.
Yeah.
A lot of, a
How
lot of
many more years is that?
that's typically anywhere from 1 to 2 years.
Okay.
Um, and the key fellowships in anesthesiology will typically be pediatrics. So people will do
Okay. Yeah, that makes
fellowships. That's
sense.
an extra year
Yeah.
or two, specializing in pediatric anesthesia, for instance.
Yep.
Or the other one is cardiothoracic anesthesia. So people will do an extra year or two, just focusing uh, on heart surgery, cardiac surgery.
Gotcha.
So that typically requires a little bit extra training
Yeah.
and the ability to read echocardiograms and things like that.
Okay.
So, um, so many anesthesiologists will do an extra year to train specifically for that kind of
And
surgeries.
is the benefit of that, I'd imagine, more specialization, which means more job security and probably higher pay,
Um,
or is it just kind of a
yeah,
passion
I mean,
thing?
I don't know. Some people just feel like they want to be uh, they more and more want to be good at one thing, and
Yeah.
that's what they want to do.
Yeah.
Often there is a payoff in slightly higher income
Yeah.
or a little bit higher demand, specifically for certain specialties.
Yeah.
But those are sort of individual decisions that people make.
Okay. Now, you have a family.
Hmm.
You seem to get some regular vacations in with good trips. Um, I don't know. I've seen you work hard, right? You work long days, pretty long weeks. But what's the work life balance like for an anesthesiologist?
I don't really know. I mean, I think you're for the most part, especially when you're starting off, you will it's a 24/7 job, 7 days a week.
Yeah.
Not for every person. Certain, most surgeries in hospitals happen any day, any time of the day, any time of the night. So
Yeah.
um, we also do anesthesia for uh, women having babies, for instance. So
Right.
that happens. So
It's not on schedule.
someone has to be available 7 days of the week, 24 hours. Now that's
Right.
not you every day necessarily, but that's where the anesthesia groups typically figure out, um, how to staff that.
Yeah.
But for the most jobs will require you to be able to work on Saturdays or Sundays and in the evenings.
Yeah.
So um, now frequently you'll have the day off afterwards or day before you work type thing. So there's some balance in that.
Yeah.
But I think uh, it's very different, for instance, than if you're an office-based
Yep.
primary care physician or family practitioner or
Right.
something like that, where you basically see patients mostly during
Yep. 5 days a
weekdays
week.
and
Yeah.
office hours. So
Right.
we have office hours plus, so to speak.
Yep.
So that's one thing that um, a lot of residents don't think of.
Yeah. Yeah. I remember you
So
carrying a pager around.
right, yeah,
Yeah.
well, that is more. But I think you have to be ready to be able to, you have to be able to do an emergency procedure at 2 o'clock in the morning or 3 in the morning,
Yep.
or do a labor epidural on a on a on a on a newly expected mother at 2 in the morning or 3 in the morning.
Right.
Yeah. So those are things that are part of the job that people have to be aware of.
Yeah.
Otherwise, you will not be very very happy with yourself. So, but for the most part, we work pretty hard.
For sure.
Um, but I think for the most part, you're able to schedule time off so you can also recharge your batteries and make sure you're ready to go. But
How do you manage that? Those late nights or early morning calls, and you haven't slept very well, and I'm
Well,
like,
that's something you learn during residency because
yeah.
that's what you do during
Do
residency
you
as
think it's
well.
something
So
that people either have, or you either have it or you don't? The ability to work and function on lack of
I
sleep.
think you learn how to do it.
Okay, so you can develop it. I don't know. I
Yeah.
look at my son, and
Mm.
he sleeps faster than anybody else.
Yeah. We change as we get older. Mhm.
He doesn't need a lot of sleep, and he functions great,
Yeah.
and my other one needs
Mhm.
his sleep, and
Yeah.
so it's good to know that that's can become a learned skill.
Yeah.
Um, what advice would you have for these ambitious high school kids? They've decided, okay, this is the path I want to take. I want to be in the medical field. I
Mhm.
want to be an anesthesiologist. Joe, what pitfalls can I avoid? What mistakes have you made that I can avoid, or what advice would you have for me?
Well, I don't know. I think you obviously have to put the work in,
Yeah,
academically, but I think you have to make sure that it shouldn't be an obsession either. You have
yeah,
to like, okay, this is my journey. This is my basic plan on how to get there. And if it doesn't work out, I can do something else where I
yeah,
can use, um, I can pivot into a different direction if I have to.
yeah,
Um, a lot of people don't get accepted into medical school, so you can't let that be such an overwhelming thing for you that if you don't get in, if you find out, hey, you know what, this is just not for me, I can't wait for 12 years until I get my first paycheck. I need to get, there are other pathways in medicine. Medicine is a very broad field with
yeah,
a lot of different um, um, avenues to work in that field and have a very rewarding career
yeah, yeah, for sure.
without necessarily, having to go to med school. So, uh, it's a fair amount of debt to take on. It's a long pathway. I think if it's a calling and you really want to do that, that's great.
Yeah,
And then just be ready for it and take it one step at a time. Um, but always realize um, that you have a lot of ability to do a lot of other things in the healthcare field. If that's what I want to do, if
yeah,
that's what you want to do, and keep your options open. Um, And so I think that's the main pitfall is that people feel they put so much stake in that, hey, I want to go to med school, that's what I want to do. And then to realize that, you know what, I can be very successful and have a great career,
yeah,
even if that doesn't work out. And so I think if you can be good with people and you're willing to learn and always willing to learn new things,
yeah.
willing to keep your options open and see where the opportunities are, then I think things will work out.
Okay, I love that. I'm sure a lot of people, if not everybody listening to this, will either have been through surgery or will go through surgery sometime. You're on the other side of that. What advice would you have for future patients?
I think most patients now, uh, at least that I encounter, are they uh, are basically ready for it. They don't
Yeah.
really overthink it. It's basically like getting on a plane, and you're like, okay, I trust the pilot's gonna know what they're doing.
Right.
But always do your research. Understand what. Always be your own advocate.
Yeah.
Understand what you're going through. Understand a little bit about the anesthetic so that you can ask some informed questions to your anesthesiologist.
Yeah.
Um, so those are, do a little bit, of your own work, research what's going on, and never feel free to ask a question. And even if you think it's a dumb question, just
Yeah.
ask it. Make sure you're comfortable with what you're hearing. These are professional people that deal with it all the time,
Yeah.
and be your own advocate.
Yeah. I love that. It's been great. Thank you very much for
Oh,
taking
you're
the time,
welcome.
man. I learned a lot. Yeah, it's cool to hear the side of things. I just see you going into work and coming back tired, but I never get to hear about the behind the scenes.
Yeah.
So
Oh, it's my pleasure.
thanks,
Thanks for
Joe.
having me.
Yeah, thanks, man. I hope you enjoyed that conversation with Joe as much as I did. It was interesting to hear of the many different ways to manage the patient's stress response during surgery. or how the stressful situations don't feel that stressful because of the confidence you build through training and practice. I also like what Joe said about how you don't have to be set on becoming a doctor, and how you'll discover there are many paths out there to make it in the medical field. If you enjoyed this podcast, give us a like and follow. You can also check out our website at htbpod.com to see a database of jobs we've interviewed for already. And if you feel like you have an interesting career and want to tell your own story on our podcast, just go to htb.com and submit the form. Thanks again, and see you next week.